Interpreting Odds Ratios and Risk Ratios, a Biostatistics Guide for Clinicians. Hello, everyone. Welcome back to the channel. I'm Myada, and today we're diving into the world of biostatistics to talk about two essential concepts that clinicians encounter in research: odds ratios and risk ratios. By the end of this video, you'll feel more confident in interpreting these ratios and applying them in your clinical practice. Let's get started. Before we jump into the details, let's clarify what we mean by odds ratios and risk ratios. Odds ratios, and risk ratios, are both measures of association used in clinical research. They tell us about the relationship between an exposure and an outcome. Risk ratio. It compares the probability of an event occurring in the exposed group to the probability of the event occurring in the non-exposed group. Odds ratio. It compares the odds of an event occurring in the exposed group to the odds of it occurring in the non-exposed group. While they sound similar, they're used in slightly different contexts and can lead to different interpretations. Let's explore each in more detail. Imagine we're looking at a group of patients. Some are exposed to a risk factor, like smoking, while others aren't. We then follow them to see if they develop a disease, like lung cancer. The risk ratio is calculated as the risk or probability of the event in the exposed group divided by the risk of the event in the non-exposed group. Risk ratio, RR, equals risk in exposed group / risk in non-exposed group *. And relative risk of 1 means there's no difference in risk between the two groups. And relative risk greater than 1 means the exposure increases the risk. And relative risk less than 1 means the exposure decreases the risk. In clinical practice, risk ratios help us understand the relative risk associated with a treatment, behavior, or exposure. Section 3. Odds ratio explained. Cut to visual representation of odds, maybe using dice to symbolize odds. Now, let's talk about odds ratios. Odds ratios are commonly used in case control studies, which compare patients with a disease, cases, to those without the disease, controls. The odds of an event are calculated as the number of times the event happens divided by the number of times it doesn't happen. Odds ratio equals odds in exposed group / odds in non-exposed group *. An odd ratio of 1 indicates no association. An odd ratio greater than 1 suggests the exposure is associated with higher odds of the outcome. An odd ratio less than 1 suggests the exposure is associated with lower odds of the outcome. Odds ratios are particularly useful when studying rare diseases or when conducting retrospective studies. But be careful, odds ratios can sometimes be misinterpreted as risk ratios, especially when the outcome is common. So, when should you use risk ratios versus odds ratios? Here's a quick guide. Risk ratio. Use in cohort studies or randomized controlled trials when you're following participants over time and the event of interest is common. Odds ratio. Use in case control studies or retrospective studies, especially when the outcome is rare. Remember, when the outcome is rare, the odds ratio and risk ratio can be very similar. But as the outcome becomes more common, the odds ratio can overestimate the risk. Let's go through an example. Say you're looking at a study examining the effect of a new drug on reducing heart attacks. In the exposed group, those who took the drug, 5 out of 100 people had a heart attack. In the non-exposed group, those who didn't take the drug, 10 out of 100 people had a heart attack. The risk in the exposed group is 5%, and in the non-exposed group, it's 10%. The risk ratio would be 0.05 divided by 0.10 is equal to 0.5. This means the drug reduces the risk of a heart attack by 50%. Now, let's calculate the odds ratio. The odds of a heart attack in the exposed group are 5 to 95, and in the non-exposed group, they're 10 to 90. The odds ratio would be 5/95 / 10/90 is almost equal to 0.47. Again, this suggests a protective effect, but the interpretation isn't exactly the same as the risk ratio. To wrap up, here are the key takeaways. Risk ratios are intuitive and give a direct comparison of probabilities. Odds ratios are often used in case control studies, but can be tricky to interpret if the outcome is common. When interpreting either ratio, always consider the context of the study design and the baseline risk. Understanding these ratios can help you make more informed decisions when evaluating research and applying it to your clinical practice. Thank you for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe to the channel for more biostatistics tips and clinical research insights. Leave any questions you have in the comments below, and I'll see you in the next video.